I'm Dr. James Byland. I'm a clinical and educational psychologist and the owner and director of the Byland Clinic.
Hi, my name is Danielle Morales. I'm a licensed educational psychologist and the co-director of the Byland Clinic. And today we're here to talk all about IEP qualification and eligibility, specifically to start off what the difference is between a 504 and an IEP. So, James, can you talk through some of the high-level differences between a Section 504 plan and an IEP?
Yeah, no, it's a great question, and one that comes up a lot when we're doing our independent educational evaluations. A lot of times we're doing these because there's a question about eligibility, right? The school district says maybe the child is not eligible for an IEP. Parent believes that they should be eligible for an IEP, and maybe the district's offering what they call, a 504 plan. In lieu of an IEP. So this is a question that comes up a lot when we're doing our evaluations. There's a lot of similarities between the two, and there are a lot of really important differences. So both of them are in place to allow children with disabilities to be able to access their education, right? So that access piece is the same between the two, right? And they're both intended for kids that have disabling conditions that impact their ability to access their education. The difference is while an IEP supports the child's access to their education, it also provides what's called specialized academic instruction, or in the federal regulations, specially designed instruction. And so what that is, according to federal regulations, is adaptations in what they call the content, the methodology, or delivery of instruction. So, what's being taught, how it's being taught, by who, when, and where it's being taught. But there's some adaptation in the actual instruction that the child's receiving during the school day. Versus a 504 plan provides accommodation. So these are things that are done within the regular education environment. So we're not changing their instruction in any way. We're just providing accommodations for them to be able to access their instruction in the regular classroom. So maybe preferential seating, or they get additional time on tests or assignments or things like that.
Mhm. And when we're talking about changes to content or methodology or how those things are delivered, is that contextualized purely to academics, or does that encompass if a student has mental health or behavioral needs?
No, no, it's a really good question. So no, it's not limited to academics, right? So, if you're looking at an IEP specifically, there's sort of 13 eligibility categories. Only one of the 13 do the regulations specifically call out academic achievement, right? Basically, how you do on tests of reading, writing, and math. And that's a category for specific learning disability. There's 12 other categories, including categories that cover children that have various social, emotional, and behavioral disorders. And what they talk about is educational impact. So not just academic achievement, but educational impact. And that's a pretty broad term, at least how it's been interpreted, by judges across the country. And it includes things like, kids, social interactions, their attendance, their behavior in class, their work production. A lot of things that could be impacted by a child's social, emotional, and behavioral development, right? So, are their behaviors leading to disciplinary action? Are they missing school as a result of that? Are their behaviors more related to sort of internalizing disorders where they're shutting down in classrooms and they're missing instruction as a result of that? Or they're not able to get to school in the morning or to be able to produce their work, or they're having challenges, socially with their peers and their teachers. These are all part of the sort of this broad term of educational impact that again goes past reading, writing, and math. And that is one of the challenges I think school teams encounter is they try to base it solely on academic achievement scores, even when there's a really clear educational impact. So no, it definitely covers both the IEPs and 504s cover disabling conditions that might impact your schooling in ways other than your reading, writing, and math scores.
Yeah, I appreciate the delineation of all the different categories that these things can show up in. One of the things that I encounter a lot in my practice and work with clients in particular is the high functioning autism and the 504 versus the IDA eligibility. Can you talk through some either common pitfalls you see in terms of looking at 504 versus autism support versus an IEP level of support for autism, excuse me, as well as some of the changes that were made to the autism eligibility classification a couple years back under the California Education Code, specifically targeting these kinds of questions that we're talking about today?
Yeah, for sure. So to kind of like take a quick step back and then kind of come back to the autism piece more specifically. I think there is a way of taking a look at the educational impact and whether or not an IEP is needed, whether it's for autism or something else. That in my mind makes a lot of sense. And one of the issues I find with schools is they don't really have a clear process for doing this, right? They conduct this evaluation, they gather all of this data, and then they make this determination of whether they're eligible or they're not eligible without really delineating what their rationale or process was for determining 504 versus IEP. And I do think that's a really good place to start. And I think you can apply this process to looking at kids with, say, high functioning autism and how that, what the educational impact of that is and whether or not they require an IEP or not. So again, both 504 and IEP provide protections for children with disabilities. So that's that, right? So, if they're making a recommendation for 504, there's some acknowledgement that there's this disabling condition that's affecting them educationally, right? But I think the first step is to really pinpoint what even beyond educational, what are the needs, that stem from that child's disability. And then once you identify those needs, you can say, okay, well, what's the educational impact of those? Like how are they impacting them, educationally, not just academically, right? Not just reading, writing, and math, but all of those other things we talked about. How are they impacting them educationally? And then you want to say, like, set a goal, right? So if we were to set one or more goals for this child for what we'd like to see them doing differently so that they are able to access and benefit from their education, what do they need to do differently? Uh, and then the fourth step is to say, okay, well, what do we as adults, as an educational team, need to do to help them achieve that goal, right? And then the fifth step is to now take a look at that list of things that we determined the educational team needs to do in order to be able to help this child access their education, right? Now look at those and say, okay, are all of those simply accommodations? Are they just, things that we're going to do in the regular education environment without making any adaptations in what's being taught, how it's being taught, by whom, when, and where it's being taught? Then a 504 plan is appropriate. If all of those lists of things and supports that we came up with are things like we need additional time on tests and assignments, we need preferential seating in the classroom, we need movement breaks, whatever it is, right? Say, okay, that's a 504 plan. If one or more of those things is changes again in the content, methodology, or delivery of instruction, what's being taught, how it's being taught, by who, when, and where it's being taught, then we're really looking at specially designed instruction, right? We're looking at an IEP. That would include both those instructional services and the various accommodations that we generated, right? So I think that process is helpful, and I think you can apply it to kids with any number of different neurodevelopmental disabilities, or social emotional conditions that are impacting them educationally. And so you brought up the piece around autism. Well, maybe when we identify what their needs are, maybe the child with high functioning autism, their reading, writing, and math skills are sufficient for them to be able to access their instruction, right? But there's other ways that their disabling condition is impacting them educationally, right? So it's impacting them in terms of their, socially, with their relationships with peers and adults. It may be impacting, their work production, right? Maybe they've got the reading, writing, and math skills, but they're really struggling in their classes due to issues around executive functioning that might be impacting their educational performance, even though their academic skills are adequate. And so obviously each child is different, but again, certainly kids that have high functioning autism whose academic skills are average or sometimes even above average range, still may be greatly impacted educationally for a variety of reasons, whether it's socially, whether it's behaviorally, whether it's related to their executive functioning deficits. That there's any number of ways that their disability might show up and impact them educationally. Again, even though reading, writing, and math is okay.
Thanks for that analysis. I think that's a really helpful way to talk through those different points to look at, those different question marks, and how you can apply it to a specific case. So what are other common pitfalls or flags you see in districts' analyses of eligibility? So we've talked a little bit about this, but are there areas you would let parents know in particular to be in the lookout for areas that maybe weren't adequately assessed or shortfalls in terms of going through those questions in a really detailed and thoughtful manner?
Yeah, I mean, you certainly, again, we've talked about it, but obviously one of them being like, what is specially designed instruction? What is specialized academic instruction, and really having a process for determining that, right? And again, I think following that those 5 questions is very helpful. And I've never seen a school IEP team do that. To be honest with you, I've come to IEP teams having conducted an independent educational evaluation and sort of led them through that discussion. But I've never seen a school team do that on their own. So I do think that's something to be mindful of when they're making that determination. There are some things that sort of are inherently sort of problematic with just sort of the special education system, that leaves a lot of gray area for disagreement. One of the sort of hallmarks of special education is the child needs specialized academic instruction, right? So that's spelled out in the regulations that not only do they have this disabling condition, but they need specialized academic instruction as a result. And it's just not defined in the regulations, and it's not clearly defined anywhere in case law. And so that is an area where there's sort of continual disagreement, between parents and school districts around whether or not their child actually does need it. Again, I do think that 5-step process is helpful in determining that, but there's still going to be some ambiguity in some cases around, okay, yes, they would benefit from that, but do they need it? I would say to parents that when you're talking with IEP teams, it's really important to steer away from things like what's sort of optimal for your child, because the regulations don't require that schools provide what's optimal for your child. I think sticking really clearly to things like these are things that are appropriate, right, versus optimal, and these are things that my child needs, not just would benefit from. So I think using sort of that language is really important. Again, that these are things that are appropriate, not optimal, and these are things that my child needs, not just benefits from. I think are important things for parents to kind of keep in mind. There are some pitfalls for districts that are really just pretty black and white, though. They're looking at, they're conducting a psychoeducational evaluation, and they don't look at all areas of quote unquote suspected disability, right? So kid has documented attention problems, but they only look at specific learning disability. They don't look at ADHD, for example. There's they don't look at all areas of processing related to some learning disability, right? So we see it less now with reading, but we used to see it a lot with reading, where school districts would only look at one area of processing related to reading, and they'd have this massive underachievement in reading, and they say, well, we didn't see the processing disorder. Well, just because you didn't look doesn't mean it doesn't exist. So they have to look at when they're assessing, particularly for a learning disability, they've got to look at all areas of processing related to that learning disability. And while I see that less and less, that's still a common pitfall. One where we've seen some huge gains in California this past year with sort of updates to what they call SACE, the Special Education Information System that most school districts use for sort of documenting for creating their IEPs and documenting eligibility and so forth, is the regulations have always said that reading fluency was an area of eligibility. The SACE system didn't always recognize that. And so there was a lot of school districts where you had kids with dyslexia, and it showed up in massively impaired reading fluency. And they were saying that they weren't eligible because that wasn't on the form. That's ridiculous, right? The form isn't the regulation, but fortunately they've added that. But you still see that sometimes too, where they're just they don't have a real clear understanding of what the regulations actually say, and they're just sort of following a checklist, and that can lead to issues. And I would say another one. Well, actually, 2 more, right? Sometimes the academic achievement tests that the school district gives are just poor tests. There's a very common test. The first test I ever learned to give was the Woodcock-Johnson test of achievement. School districts everywhere give it, but there's certain tests on there that just aren't that great, even with the updated version of the test. notoriously the reading comprehension and writing samples tests from that battery are really pretty terrible. And that's a whole conversation on its own. So sometimes just the tests that are being used are leading to determinations of ineligibility when they simply used a bad test. And then the other thing I would say that comes up that's really super important is, again, whether it's the 12 disability categories that are not based on academic achievement alone, or honestly, even for specific learning disability, when the district really leans just very heavily, almost exclusively on academic achievement test scores. So they say, well, they performed in the average range on these measures of reading, writing, and math, and they don't take into consideration the child's educational performance or the broader educational impact of their disability. And I know we've hit on that one a number of times today, but it's really important for parents to understand that. That if you have a child that has a disabling condition that's not a specific learning disability, and the school district says they're not eligible because we gave this test and their reading, writing, and math scores were average, it's really important as a parent to understand that that is not the criteria for eligibility.
Yeah, and conversely, having good grades alone is not the sole
No.
qualifying factor, right? And I know that comes up a lot where you'll see a student that performs poorly on standardized testing, whether that be the batteries that are given through the psychoeducational process or the state standard testing, but they're doing pretty okay in the classroom, right? They're passing their classrooms. Maybe they have A, B, a couple C's, and that's used as evidence that there's not applied adverse academic impact. And I think that's just another thing to lift up for parents too, right? That grades are also subjective measures, and sometimes those are inflated for various reasons. And that's not to say that that's intentionally being inflated, but there's a lot that can be going on behind the scenes to even get a student to a C, right? Multiple test retakes, a lot of scaffolding, open book assessments. And so really unpacking why they have grades at the level that they do is important, especially if there's a discrepancy between standardized testing and the grade component, but just putting a pin in that for educational impact, because I know that's a big area of frustration.
That's a great point. Yeah, that's a really great point. And that has been litigated, and there is established case law that says that sort of matriculating from grade to grade or the grades you get in your classes, are not the determining factor of special education eligibility. But you brought up really good points, and I feel like we see this more and more, that you really have to unpack what that grade is, and again, it doesn't show the level of effort that parents and private tutors are putting on behind the scenes. A lot of times the work that they're turning in doesn't actually reflect their actual skills. And you mentioned how the grades are balanced, right? How much of it is based on participation, how much of it is based on turning in homework assignments, how much of it is based on testing. And what I'm seeing more and more now too is there's so many different just sort of kind of quote unquote accommodations that every child gets, right? Where there is no actual deadline for tests. People get 50% credit for even if they don't turn in anything at all. There's multiple test retakes. Sometimes kids are getting pulled into small groups with help for their retaking those tests. So really understanding what's going on behind the grades. But I agree. One is just clearly established in case law that that's not the determined factor. But it's increasingly kind of problematic when those grades aren't actually reflecting the child's true development. And I think a lot of parents got a snapshot of this during COVID, when they were actually home with their kids and saw what they were actually doing, and realized wait a minute, this isn't even close to grade level standard.
Yeah. One thing that I recommend for parents who are in those situations, especially if they're at the high school or middle school level, is actually getting the printout of what makes up that grade. And you touched upon this a little bit, right? But one of the common trends you'll see, for example, is a bunch of A's and B's in areas like participation or in-class assignments, and then an F on every assessment. And so being able to pull apart data a little bit more finitely and say, look, they really aren't understanding the standards when push comes to shove, or they aren't generalizing it, or they're not able to independently show that because there's some barrier, is important. And you can request that information. A lot of times it's on, the websites where they post the grades. You can print out a breakdown of that. I want to circle back with eligibility, but I do want to spend a little more time on this adverse educational impact at a little bit of a more finite level, just to break down terms a little bit more, like what does an adverse behavioral impact look like? What's an adverse social skills impact look like? And also with attendance too, right? And so, when we're talking about adverse impact based on behaviors, things that are going to come to mind for me are kids that are sent to the office frequently for acting out. So maybe they're, missing blocks of their instructional day, and that might be due to a disability that hasn't been adequately assessed or identified. For example, maybe they have impulse regulation control issues due to ADHD or, a mood disorder, for example. Or, social skills impairments, meaning, they don't really have meaningful or deep friendships, or they're not participating in group or collaborative assignments. Attendance, obviously, if they're having huge trouble getting to school in the morning, whether that be based on anxiety or an undiagnosed learning disability that's making school really effortful and they're burning out. But are there other examples that you can think of, James, or just talking points that parents should be aware of in that broader umbrella of educational impact that are a little bit more concrete examples?
Yeah, no, that's a really good question. One thing that just real quick, sort of immediately came up too, is sometimes districts will use attendance as sort of a rule out factor, right? Well, they're say, and there is some there's some basis for what they're saying in the regulations. I know the parts of the regulations where they're getting this from, but they'll say, they're not eligible because their attendance is poor, and that's why they're having a hard time learning. If they look more closely at the regulations, it says it can't be primarily due to school attendance, right? And so, there's a lot of situations where maybe their poor attendance is actually a result of their disability, right? So, like you mentioned, kids with high levels of social and performance anxiety, for example, might have a hard time, getting to school. Or even the example that you gave around, kids that have a learning disability, and in school over time becomes, exhausting and effortful, and it feels really crummy to go to school, and so they don't want to go to school anymore. And then they get assessed, and the district says, oh, well, they never come to school, so that's why they're not learning. But you can actually sort of go back through their history and see the patterns of their performance and development prior to their poor school attendance, right? And I think there's some things that you can certainly do, through careful assessment and review of the records, that can show that, hey, this disability is secondary to the attendance, rather, secondary to their disability. The underachievement or poor school performance isn't a consequence of their attendance; it's the other way around. And so I think those are some important things to look at. You mentioned like some of the impulse control difficulties and social difficulties, getting sent out of the classroom, resulting in various sort of consequences related to their behavior that result in them being out of the classroom, either part or all of the school day. Those are certainly some good ones. I think there's a lot of issues around like executive functioning that we see with various disabilities, whether it's ADHD, or autism or other conditions where, they're just really struggling to sort of, manage the work, right? And so, here you're seeing a lot of, missing assignments, late assignments, incomplete assignments, and kind of going back to the conversation too around, what's behind the grades, is really kind of keeping track of, not only, what mark they got on that, but did they get extended time to be able to get that assignment in? How much work or support was needed by school staff, parents, or outside tutors in order to be able to get that work and turned in? Because it may be that the assignment was due in September, they got it in December, they got full credit for it, their grade looked okay, but there isn't any accounting for what happened in the 3-month span that it took to get that assignment turned in. So I think that those issues around executive functioning, around planning, organization, task completion, or other things to look at as far as educational impact.
Yeah, well, I think that dovetails nicely into the other topic that I want to make sure we cover, which is, again, unpacking a little more what are holes that parents should be on the lookout for. So when you're talking about attention executive functioning, that immediately flags for me areas that are commonly missed in assessments are attention and executive functioning when ADHD is suspected. And so, for example, they may do a battery that's more geared towards identifying a learning disability like dyslexia, and the student does not ding on any of those measures. They don't show processing deficits in those areas. And so, the ADHD is not identified. The any other health impairment under educational code is not identified. So I think that's a big hole. I know we touched on already a little bit the reading disability battery, but I think for parents it'd be helpful to know, okay, if I'm looking at a reading disability assessment in front of me, what are the kind of high level boxes I want to make sure are checked, right? And so if you're concerned about dyslexia, we want to make sure that, as you said, reading fluency was assessed, reading decoding, reading comprehension, phonological processing, orthographic processing, rapid naming, verbal memory was assessed, as well as vocabulary. Are there any other areas that parents should be on the lookout for reading? Again, reading is a little easier to drill down on, and we can touch upon the other learning disabilities, but.
Mhm. Yeah, I appreciate you walking through that list. So that's a good list of areas of processing we want to make sure that that kids are being assessed in, so that the school district doesn't come back and go, oh well, yeah, they've got this massive underachievement, but we didn't find a quote unquote processing disorder. Again, the fact that they didn't find it doesn't mean that it doesn't exist. I think if certainly if you live in our area, and you have some questions or concerns about like that was their rationale, was there was no processing disorder, contact us or somebody else who kind of knows what they're talking about, because that is a really common pitfall. And I think it's hard to know, without the type of training and experience that we have, to be able to look at that report and know that and not even just like the areas they kind of quote unquote assess, but really understanding how those tests are administered. What are the input and output functions of those tests? Because you might have two tests that are kind of reported to measure the same thing, but they're actually measuring very different skills. And so I think certainly there's a checklist, right? Like if you're looking at reading, did they look at phonological processing? Did they look at rapid naming? Did they look at orthographic processing? Did they look at verbal memory? All these areas that we know are related to reading development. But sometimes it takes an expert to really take a look at not only what areas they assessed in, but what tests they use to measure those skills, right? So if that's a question, if that's their rationale, they didn't have a processing disorder, and you might just want to contact somebody and get a consult on that. One thing I would say for parents too, though, is if there's questions about the test themselves, ask for examples of what they were asked to do. If they give that test, the Woodcock-Johnson test of achievement, and they say, oh, their writing samples looks fine, ask them for printout Xerox copy of the writing that they actually produce on that test, so that you can take a look at it, and then bring in examples of their own independent writing samples, their unassisted writing, and hold the two side by side, from classroom assignments, right? Because what you'll find is they look very, very different from one another. And I've literally seen scores on that test that say kids' writing is above average when their writing is atrocious. And it's not like a knock on the kid. I mean, they have a very legitimate writing disability, and somehow the test score on that particular test came out really, really high. And without getting into the details, if they're given that test, just ask for copies of it, and you'll see exactly what I'm talking about. I think also, getting into the details around like the reading comprehension test, like how did they measure reading comprehension? And then looking for other examples of what their reading comprehension looks like in their actual school performance, right? And some of that might be tests that are administered in the classroom, formally or informally, but again, sort of asking specifically, like either to get work samples from the test itself to hold up against your own work samples, or ask, how is their reading comprehension assessed? And here some other pieces of sort of artifacts that I have that demonstrate where we see their reading comprehension in the classroom and at home, because sometimes those things look very different from one another.
Yeah. No, that's a great point to tap in somebody that has training in the testing batteries and understands those nuances. I mean,
sorry to interrupt you, but sometimes I was a school psychologist. I have great respect for school psychologists. The level of training varies dramatically. And a lot of times what you see are school psychologists are sort of defaulting to what the not having really in-depth understanding in terms of why two test scores look very different from one another when the test publishers say they're supposed to measure the same thing. And sometimes it really does take somebody with a little bit more knowledge, a little bit more experience and training to really understand why we're seeing that discrepancy, in order to be able to explain that, in the context of, that child's lived experience. And sometimes that's an issue.
No, totally. No, I appreciate the nuance there because even when we're doing like a checklist approach, I still think that's a very it's a step one approach, right? So, okay, did they assess all these areas? But then if phonological processing, for example, was assessed and came back as average, then you really do need a professional to look at and say, well, did it, measure advanced phonological processing, for example, or just having familiarity with how the tests are structured, like you're saying, and the differences because they're not apples to apples. And we're professionals, so we're trained in dozens of these tests, and we just know that some of the tests are easier. They're not as in depth. They don't have as good statistics behind them. So it's important to understand those nuances, even if they were assessed in all areas and no issues were found. And I think the other thing to touch upon is for other reading disabilities, like I agree. I think within our field and within schools, there is growing awareness of a more concrete assessment approach for things like dyslexia. But other learning disabilities like math and writing are really, really broad. And so it's really hard to know without having a degree if all areas were assessed that were relevant to math and writing, because math can be impacted, just like looking at that as an example, by so many different processing areas, right? Like different types of memory, like associative memory and working memory. And then, it's also impacted by all these areas of attention and executive functioning skills and fluid reasoning and visual processing. And so, if you're not finding a quote unquote processing deficit, it very well may mean that there just wasn't enough digging that was done to unearth that. I'll pause, and if you have any thoughts on that, but then I do want to make sure we get to autism this morning because there was changes in the educational code a couple
Oh
of years
yes, I
ago.
forgot about the question.
Yeah. But
Yeah,
do you have anything else on learning disability
yeah,
pitfalls?
yeah. No, I mean, just reiterating again that absence of evidence is an evidence of absence, and a school psychologist sort of quote unquote standard battery in many cases is just isn't sufficient for identifying those areas of processing that might be impacting the child.
Yeah. And, I know that previously we've spoken about IEEs. So, a reminder that if this conversation is resonating and you feel like, the 504 isn't sufficient or your child was denied, an IEP and you want a second opinion, that second, independent educational evaluation is important, or just consultation support through a clinic like ours or, another similar set of professionals. But I think, to wrap up, I do want to make sure we talk about autism because this is a huge area that I see where, you'll have a student, again, particularly with the high functioning, autistic profile, where a student will score beautifully on measures like vocabulary or more concrete, language measures, and that's used as evidence to say they don't qualify under autism. So can you talk through a little bit common pitfalls parents should be on the lookout for in the autism eligibility in particular?
Yeah. No, I mean, earlier you mentioned some changes in the regulations, and that's true. And trying to think, probably going on 10 years now. The California regulations used to have these really sort of off the wall criteria for what they call like autistic like behaviors, and what they really described were kids on sort of the moderate to severe end of the autism spectrum. Right. They didn't adequately capture, kids sort of more on the moderate range, the more, sometimes referred to as like high functioning autism, or kids with, average range intellectual abilities and autism. Right. Now, when they changed the regulations, it did better mirror what we have in terms of our clinical diagnosis. Right. One of the problems with the regulations is they're very brief, right? That they're not terribly descriptive. But what they try to capture are these two primary elements of autism, right? One of them is this impairment in social communication and interaction, right? Which I think you're getting a little bit to in terms of some of the testing that might be given. And the other are these restrictive, repetitive behaviors and or interests, including sensory sensitivities, right? And so clinically when we're diagnosing autism, we're looking for both of those, right? And our clinical diagnostic criteria is a little bit more specific in terms of what the specific elements of those are, right? Now, I think you brought up the piece around here around like maybe they gave a test that looked at their vocabulary as a measure of language development, for example. Well, that's a pretty one that's a very limited set of language skills. and frankly, ones that aren't necessarily related to autism, right? So we definitely have kids on sort of the more moderate to severe end of the autism spectrum who have significantly impaired language and may even be, nonverbal or use other methods of communication, other than verbal communication, right? But for our kids with sort of this more sort of high functioning autism, in the past we used to, there used to be this yeah separate category, for describing, those kids, and maybe have very strong verbal skills, right? That like maybe have exceptional vocabulary, right? Their vocabulary might actually be sort of in this, above average, sometimes superior range vocabulary, strong verbal reasoning skills. But that's really separate from their autism, right? Because when we're looking at these language communication deficits in autism, we're looking at that social communication, right? That social communication and interaction, which has to do with their ability to, their social emotional reciprocity, right? Their ability to kind of perceive other people's thoughts and feelings and to be able to empathize with those situations. Their ability to kind of integrate their verbal and nonverbal communication, right? So, things like facial expression, body language, tone of voice, prosody that supports social communication and interaction, and their ability to build and maintain relationships with others. None of those have anything to do with their vocabulary, right? So I think this kind of gets back to the issue sometimes too, with just sort of the lack of the narrow or shallow understanding, of some of the professionals who are conducting these evaluations and say, oh, well, their communication skills are fine because their vocabulary is good. Well, that really has nothing to do with an autism diagnosis or the eligibility for an IEP under the category of autism. It's just a different aspect of language.
Yeah. Yeah. And I think that's a good illustration again of all the layers that are inherent in each of the IDA eligibility categories. And so if you do feel again that things were not looked at properly, getting that second opinion is really important to say, hey, this test, again, it may be classified under this realm, but it's really only looking at this narrow band of skill as opposed to skills XYZ, which are also important to talk about.
Yeah.
Anything else that you want to touch upon before we close out today on this topic?
Yeah, no, I mean, I guess it's one other thing that kind of keeps coming up for me as we have these conversations. It really is important, when there's these questions or perhaps sort of disagreements around eligibility and services, that you get the support of somebody that has both clinical expertise and knowledge of the educational regulations. If somebody has sort of lived their whole professional career, in a clinical setting, and they don't understand the special education regulations, that that's going to limit their ability to, communicate and advocate for the child's educational needs, right? And if somebody has spent their whole life working in a school setting, that their understanding of these neurodevelopmental conditions and how they might manifest and impact a child educationally, may similarly be limited, right? And I think that is one of the nice things that we offer at our office is a combination of those two things, that we really look at it through both lenses and get a full picture, of the child, how their disability may be impacting them educationally, and then most importantly, what can we do to meaningfully help them.
Yeah, I think that's a great point. All right, well, thank you, James, for your time this morning. I think this was a really helpful discussion.
Awesome, thanks, Danielle.